So basically, half the abstracts here are about MRD. Us in the academic community, we love talking about MRD, looking at trials that use MRD, talking about what exponents to use to define MRD. And Dr. Dormer from University of Chicago did a very elegant survey of physicians, primarily academic, about 2 years ago that showed that about 60% of physicians, again, primarily academic, were using MRD, or at least were checking for MRD in their patients, and maybe about a third of them were actually using it to guide their decision making. We were interested in saying, well, let's do that survey again with a different cohort, and in this case, primarily community-based. And so I think the big difference between that one and this one is now we're looking at physicians self-reported who say that they're mainly in the community. And the biggest thing that we found, so the thing that surprised me was that it was like we had a 70-ish physicians who responded. 70% of them were in the community based, and basically they reported on average checking MRD on average in about 40 to 50% of their patients, which is much higher than I would expect, because again, technically MRD is not in our standard of care anywhere. So we see a lot of our trials, we talk about MRD as a prognostic endpoint, but in terms of using it for the patient sitting in front of you, I only do it after careful decision making and talking with them about the data at place. Here, basically, 40% of community doctors who treat every kind of cancer, they know what MRD is, they're checking it in their patients, and about a third of the physicians who said that they check MRD actually said they do use it to guide treatment decisions, for example, to de-escalate therapies. So I think what mainly, there are other takeaways from that. So basically we found that, these community-based physicians are also in the US are also using peripheral blood mass spectrometry pretty commonly. We found that gene expression profiling is probably less used, only about 5 to 10% of them use it routinely in their patients. And so there's a lot that's evolving, but it's funny that if you could look at comparing GEP to MRD has really come to the limelight much more recently, but now is being used much more commonly. And I think it's the main takeaway for me is that as we, from the academic side, in our kind of vaunted towers, our privilege of being able to come to meetings like this and talk about MRD, keep talking about it, people are listening, people are using it, all of our colleagues in the community, and I think it's important to recognize that.